Hi, this is Amy Wilcox. Welcome to SWG 585, Community Needs Assessment. This is me. I did my community needs assessment on substance-exposed infants. This is a beautiful day today on the Eastern Shore. Temperatures around almost 80 degrees. I didn't get much time to spend outside today. The purpose of my assignment community assessment was to look at, because there's been a substantial increase in the number of substance-exposed infants and those diagnosed with neonatal abstinence syndrome within the last decade. These innocent babies are suffering withdrawal symptoms at birth and may have to receive morphine or methadone to wean them. There is little known about the long-term consequences. These innocent babies are overwhelming the child welfare system. Previous efforts have focused on pregnancy and identity at birth. And there appears to be a need for comprehensive services for the infants once they are identified. Here's a display of, as you can see, over the last decade, how the number of substance-exposed infants has just steadily increased. My data sample collection process, I did 2 interviews by phone, and I reviewed the DSS information on the substance-exposed infant policy. One of my interviews was with Jen Wright. She's a physical therapist through the Early Intervention Part C, Infants and Toddlers Parent-to-Infant Program of the SHORE program. This is one of the 3 distinct programs authorized by the federal government to address postnatal interventions of substance-exposed infants. The next person that I interviewed was Kathy Lewis. She is the nursing supervisor, Nurse Family Partnership Program through the Accomack County Health Department. This is an evidence-based program that works with first-time mothers or mothers that did not raise their first child to promote a healthy pregnancy and continue to work with them until their child reaches the age of 2. I also looked at our new policy. Mary Walters conducted a PowerPoint presentation through VDSS CPS policy specialist. This policy went into effect July 2017 as a result of changes in CAPTA, provisions of the Keeping Children and Families Safe Act to include a plan of safe care for substance-exposed infants. And as you can see, here are the things that I'm referring to: the Virginia Department of Social Services, Substance-Exposed Infants and Plans of Safe Care, the Infant and Toddler Connection of Virginia, and the Nurse Family Partnership, helping first-time parents succeed. The results of the assessment, the findings were consistent that no one had been a part of any public initiative or collaborative group specific to substance-exposed infants. Each of us has been to a presentation by Eastern Shore Task Force agent Scott Wade regarding opioid use, but it was not specific to substance-exposed or neonatal abstinence syndrome. The 2 interviewees believe more information and training is needed regarding substance-exposed infants or neonatal abstinence syndrome, and they suggested that the Prevention Office of the Community Services Board present some of this training. DSS offers multiple trainings for child welfare workers. Completed most of those trainings through my work. There are 2 initiatives that have been created by the Health Department: Eastern Shore Healthy Community and Better Birth Outcomes. These 2 task groups hope to look at substance-exposed infants and neonatal abstinence syndrome. I was asked to join both of these task groups. The Early Intervention Part C program has just been taken over by this new group, Little Hands, Little Feet. So they are not aware of substance-exposed infants, neonatal abstinence syndrome, of their policies and programs, but they do not know of specific interventions that would be appropriate. They're just learning about those that may be appropriate for this clientele. Additional stakeholders identified were the Eastern Shore Community Services Board and pediatricians of the Eastern Shore. It was definitely found that a collaborative approach is needed so there is not a duplication of services and to ensure that these infants do not fall through the cracks. Our community in general needs to accept that opioid and opioid-like substance is a very real problem. And many in our community are in denial that this and many other social problems exist. Plan of action and recommendations, that there be a multidisciplinary team initiated by child welfare. That would include the early intervention program, the nursing partnership or visiting nurse from pediatrician, Eastern Shore Community Services Board, and perhaps others. It's also recommended for a media campaign through local radio and local newspaper. We could also have some public forums on education on substance-exposed infants and neonatal abstinence syndrome, and to have community participation. Information sharing by email or phone, participation in Eastern Shore Healthy Outcomes that I've been invited to, and invitation to the multidisciplinary team. Reflection on this was, I believe what made this assessment successful was my established professional relationship with the interviewees. I do not believe that I would have been invited to participate in the task group if I was not known to the community. The key factor that hindered the effectiveness of this needs assessment was my lack of time during the daytime hours. I would have liked to have interviewed a visiting nurse from the pediatric office. However, time limitations and client crisis prohibited this from occurring. I enjoyed the needs assessment project. It was rewarding as well. Community partners became knowledgeable of my goals as an MSW and that there was an interest in helping our community in a collaborative way. I learned that aside from the time constraint, I'm able to accomplish the needs assessment. And I learned that despite all the media attention, our community still does not believe the issue is relevant to this locale. Our eyes are not wide open to this problem. Thank you very much.